and I'm one of the physiotherapists here at Hector Naidu and Associates. We're here today at the Plumstead Medical Center to answer one of the most important questions that I get asked numerous times on a daily basis. And that is, Andrew, what should I do when I get injured? Now, all of us are pretty familiar with the principles of R.I.C.E, which stand for rest, ice, compression, and elevation. But what I find in my experience is that a lot of people don't know how to get the most out of these simple strategies to decrease their healing time and get them back to feeling better as soon as possible. So what I've done today is I've brought in one of our patients called Sam, and she's hurt her ankle this morning while running, and I just want to give her the information on what she should do for these next vital 3 to 5 days. Alright, so stay tuned. Alright everybody, this is Sam, and Sam was going for a run yesterday and she twisted her ankle, and she's come to us today to alleviate some of the swelling and the pain that she's been feeling, and I'm going to show you exactly how we would do that here at the Plumstead Medical Center. Alright, so Sam, I'm going to ask you to lie down.
Okay.
And have you ever heard about the R.I.C.E procedure before, Sam?
No.
Okay. The first R stands for rest. So what I'm going to do is I'm going to ask Sam, I know you're an avid runner, but what I would like you to do is to skip running for the next few days, because any extra pressure that you put on that leg can cause increased damage and increased swelling to the area, both of which we want to avoid in these first few days.
Okay.
So I'm going to see your gait pattern later and see if you require any crutches or anything, but initially the treatment is uniform for every kind of soft tissue injury. Alright, so that's rest taken care of. The second part of the R.I.C.E procedure is ice. What I have here today is I just have a simple ice pack that we use here, but you at home can use peas from the freezer or any frozen goods. Now, one thing that's important to remember is that you always wrap this in a towel just to create a barrier between your skin and the actual ice pack to limit any ice burns that would be possible. Also, if you have any decreased circulation, it's very important that you just keep checking the area, as you won't be able to feel exactly what's going on. Right, so all you would do is simply apply the ice to the injured part, and you would want to maintain it there for about 20 minutes. And what this is going to do is it's going to limit the swelling, and it's also going to make you feel a lot better as it has an analgesic effect. Okay, alright, how's that feeling, Sam?
It's getting there.
Okay, it's not too cold?
No.
Perfect. Okay. The third principle of the R.I.C.E procedure is compression. Now what you would want to do is you want to take any kind of tape that you have at home or strapping, and you just want to wrap it around the injured area to decrease the amount of swelling that's able to get inside those tissues. You're also going to limit the bleeding, and in this way you're going to decrease the amount of time that the healing is going to take, and you can get back to your activities a whole lot faster. Very simple. What I'm going to do today, because she's hurt her ankle, I'm just going to wrap this around, and I'm going to keep it fairly tight, but not too tight that you block off all kind of blood supply, but I just want Sam to feel a little bit of a compression. And what that is also going to do is make her feel a lot better, because there's another sensation that's vying for her attention. She'll be sort of distracted from the pain, which is another good thing about the compression procedure. Alright, anything like that, and you want to leave that for the first sort of 3 to 5 days, but you want to take it off and put it on intermittently just to get that circulation to flow in the leg. The last element of the R.I.C.E procedure is probably the easiest of all of them, and that's elevation. The E stands for elevation, and the important thing that you want to remember here is you always want the injured part of the body to be above the level of the heart. In this way, swelling won't be able to sort of pool in the area, especially when it comes to the lower limbs. It's as simple as just putting the leg on a pillow. And as you can see with Sam, her ankle is slightly above the level of her heart, and in this way all the swelling and the circulation is going to end up going that way and not end up pulling in her ankle, which also will increase the amount of time she'll be injured. So this is a lot better for her, and she can do this while she's sleeping, and it's sort of an ongoing process, and it's just going to make her feel better and get her back to running as soon as possible. Alright? Sam, so I want you to stay off this leg for about 3 to 5 days,
okay,
and come see us after that. After 3 to 5 days, we as physiotherapists can use a lot more techniques with hands on, but for now I just want you to rest and take it easy.
Definitely.
Okay, thank you Sam. Thanks guys.